Welcome to today's training, Building a Nonprofit Therapy Practice That Lasts. I'm Dr. Lawson, and I'm so glad you're here. Today, I'm going to share with you why the nonprofit model is not just another business structure, but it's a pathway to truly systemic change, sustainable income, and meaningful impact in your community. I think for too long, therapists have been told that their only option is either private practice or grinding it out in community mental health. And I'm here to show you that there is a third option, and that's building a nonprofit therapy practice that lasts. So, my goal in the next 30 minutes is to inspire you, give you some practical tools, and invite you into a movement that's reshaping mental health care from the ground up. So here's how we're going to spend our time today. First, I'll talk about why nonprofits are the future of therapy. And then I'm going to break down the four pillars of a thriving nonprofit practice: systemic change, diverse funding, mission driven teams, and innovative programming. Finally, I'll leave you with some action steps plus some links to resources that you can explore after this training. You don't have to have it all figured out today, but think of this as like a roadmap that will help you take you to the next step in your nonprofit journey. And if you're watching this video, you're watching the replay, and you want these slides and you want the links that I'm going to share, then comment slides and I will send it right over to you. If you're new to my space, then you're probably wondering why a nonprofit. So, I want to talk a little bit about why I chose the nonprofit route, some of the pros and cons, and to really talk about the realities of private practice and working in community mental health. So, if you've been in private practice or you're thinking about going into private practice, it has its limits. You can only see so many clients. And if you are taking cash pay, and your income is reliant on that, then you can only serve a select few of clients that can afford your fee. If you take insurance, insurance rates are shrinking. They are absolutely horrible for maintaining, income and not burning out. And if you're working solo, it can feel like very isolating and unsustainable because you're boxed into the number of clients that you can see, and that limits not only your impact, but your ability to make money and survive. The nonprofit model, on the other hand, can definitely unlock opportunities that private practice and working in traditional community mental health simply can't get access to. You can secure grants, you can build corporate partnerships, and you can develop programs that insurance won't cover. And you can still take insurance. You can hire mission aligned therapists and scale your services to meet the real needs in your community. And the best part of this is that nonprofits allow you to combine financial stability with deep impact. You're not forced to choose between serving people and staying afloat. You get to do both at the same time. So, a resource that I want to link in here for you to go look up is the National Council of Nonprofits. It has some excellent articles on the economic power of nonprofits. This is definitely a myth that nonprofits can't generate revenue or can't generate a profit. They absolutely can. It's just what you do with the profit is different than for profits. So I want to give you that resource. I'll put it in the comments of this training too. But if you want the links to everything, just comment slides and I'll make sure I include it for you. So, pillar one in regards to building a sustainable nonprofit therapy practice is really about systemic change, right? Like the macro, bigger picture of how are we going to create impact and systemic change in our field. Nonprofits are not just about running sessions, but they're about reshaping systems. And that's my mission. That's my goal. That's what I've been passionate about since stepping into leadership in nonprofit is really how do I reshape this system? Because the way it's being done in community mental health is broken. All it does is it burns out clinicians. They feel undervalued, they're underpaid, and that unfortunately leads to poor services. So when you create accessible community-based services, you're reducing ER visits, you're lowering foster care placements, preventing hospitalizations, you're strengthening families, and that ripple effect of therapy is on a systemic level. And if we can do that without burning out our clinicians, then we're going to have a much bigger ripple effect than the system has now. So instead of asking, how many clients can I see this week? The nonprofit mindset asks, how can our services shift outcomes for an entire community? So here's how you start. You want to look at a community needs assessment. This is often already done for you. You don't have to go out there and do this yourself. I do have a template if you want it. If you want to do your own community assessment, you absolutely can. Comment community assessment on this, and I'll send you that free guide. But oftentimes, these are already done by your counties or health departments. You just have to go on your website to look at what their community needs assessment already identified as a need in the community. So once you have that, you can identify where your practice can plug in, and there's always funding in there. That's the purpose of why counties and health departments do community needs, because they get funding from the state, they get funding from the federal government, and that's how they decide which services they're going to fund. So you have to make sure whatever the gaps are and whatever they identify as a need in their community assessment aligns with your values and aligns with your services and your mission to fill those gaps. So go ahead and go to your local county health department and check out community health needs assessment by local hospitals. They're public, they're free. If you have a county mental health department, guarantee you they have a public community needs assessment that's already done. So that is your task for thinking about how your nonprofit is going to create systemic change within your local community. All right, so pillar number two when it comes to building a sustainable nonprofit is diverse funding. You have to think about your funding streams. When you're in a for profit model, your funding streams are very, very limited. And although the same foundational funding is true in a for profit it's the same as it is in a for profit and nonprofit, it's just that a nonprofit can have additional streams of funding that a for profit can't. So, foundational funding is still probably going to be your cash pay, sliding scale, premium rate, whatever it is. You can do both in a nonprofit. Your insurance reimbursement, your Medicaids, your Medicare, Medi-Cal, all of that is still your foundational funding, because that is just how mental health services are funded currently. It is a fee for service model. But you don't have to feel trapped by those reimbursements. This is where nonprofits shine, because insurance can still be a piece of the pie, but it doesn't have to be the whole pie. So, nonprofits can access foundation and government grants like SAMHSA, local community foundations. They can access corporate sponsorships. Businesses love supporting local mental health initiatives that are nonprofits. You can tap into individual donors and monthly giving programs. So, reoccurring donations that stabilize your cash flow. All of those can be used to offset a sliding scale or a lower insurance reimbursement rate. So, let's say you work really hard, you have a super specialized model that you use in your nonprofit, let's just say EMDR. And we know the cost of EMDR to provide that service is pretty high. So let's say your premium cash pay rate is, I'm just going to say 175. But you want to be able to give access to people who can't pay 175 and do EMDR, but without another funding stream, you won't be able to make that work. So what you do is you can still pay yourself the 175, but you supplement um, grants, donations, fundraising to be able to offset whatever that insurance reimbursement was, or whatever that sliding scale is that you offered to that client. So this can be done by those things that I referenced: foundation and government grants, corporate sponsorships, initial individual donors and monthly giving programs, fundraising events. You can do it virtually, you can do in person. It doesn't matter now. They don't have to be this huge event that you're hosting. They can absolutely be done online and behind the scenes. So, even starting with one small grant or one corporate partnership, or a small Giving Tuesday fundraising campaign can make a really big difference in extra cash flow in your nonprofit. So, I'm going to give you a couple of resources to look into. I personally don't recommend going after government grants per se. Government and big foundation grants have a lot of restrictive funding. You can't just use the money for whatever you want. There's a lot of reporting, a lot of outcomes. You do need to be an established nonprofit for several years, but you should still know what's out there with it. So you can go to grants.gov and look at what opportunities are out there. You can go to Candid and Foundation Directory online to look at private foundation grants. Again, not my recommendation. It's not the golden ticket for nonprofits, but it is still an option if you go the nonprofit route. What I do recommend is looking into your local community, like your local city, your local township. That's where the money's going to be in terms of corporate sponsorships, local grants from corporations, local United Ways, your Rotary clubs. All of that has funding already set aside for nonprofits, and they specifically want to give to smaller nonprofits in their community. So that is where your golden tickets are. Let's go ahead and take a look at pillar three. So with pillar three, mission driven team, right? Like you can't do systemic change. You can't have diverse funding if you don't have the right people on your team. And the truth is, therapists are burned out. We see this all the time. This is all over Facebook, it's all over Instagram. That's why there's been such this huge push since COVID. Especially with online with social media marketing to do super niche down private premium pay practices. And there's nothing wrong with that if you want to go that route and you feel totally fulfilled with that. That is still needed in mental health. But if you feel like that's not necessarily the right path for you, or you want to figure out how you can do that and serve your community, then that's what I'm talking about. But the truth is, therapists are burned out. More therapists are leaving the field, less therapists are joining the field, and they're just tired of feeling like this cog in this machine that's not going anywhere, making a difference. As therapists, we want purpose. We came into this field to make a difference, and we're purpose driven people, and we like to give back. We're probably the biggest people pleasers on the planet. But that's exactly what a nonprofit can offer. It offers you purpose, it offers you fulfillment. When you hire therapists into a mission driven practice, they're not just clocking in, they feel like they're part of something bigger. This also helps with retention. When therapists feel involved, when they feel like they have a voice and they actually are valued in that agency or group practice or whatever it is, then you're going to retain that therapist. So, a therapist that feels deeply aligned with your mission will stay longer. They're going to invest more energy and they're going to become an ambassador of your organization. I have seen this over and over again with my nonprofit. um, so a practical first step for you is to draft a mission first hiring statement. So for example, um, mine is at Hope Counseling Center. We believe therapy should be accessible to all. We're looking for therapists who want to create systemic change in their community, right? That is just going to get anyone who feels driven to do this work in our field. So here's a resource for you I want you to look at is Nonprofit HR. This has great guides on recruiting and retaining mission driven staff. And again, I'll try and link this in the comments, but if you want these slides, then just comment slides and it'll be in there as well. Pillar four. So, innovative programming is something that's super cool that people don't know that you can do under a nonprofit model. I think because most of the time, community mental health, they are nonprofits, but they're not set up because of all the hierarchy, they're not set up to have innovative programming. They stick to more of the traditional programming. And then private practices often rarely have the bandwidth to serve some of the hardest to reach populations, and they may not, and they may create super innovative programming, but they don't have the ability to again serve those people that are underserved with their innovative programming. So think about here's some examples recently. I have a client who did my program, Vanessa. If she ends up watching this, she does so many cool integrative um, kinds of therapy that are geared towards bringing astrology into her practice, right? If you haven't heard of the Black Sheep therapist, Tina, I would highly recommend joining her group. This is where innovative programming starts. It's bringing like non traditional therapy practices into the therapy room ethically. And you can do that under the nonprofit model, especially if you want to design programming that isn't just about the traditional therapy space. So, for example, under the nonprofit umbrella, you can have an outpatient program that is therapy that integrates things like Reiki, astrology, um, witchy kind of stuff. All of those things can be integrated into a nonprofit. And you can also have programming of those things that isn't necessarily therapy. You can have a coaching program under a nonprofit. You can have a program that doesn't require a master's degree. They're separate programs with separate program manuals and separate requirements for staffing. So you can build all of that under the nonprofit model. Um, so you can have trauma informed workshops for foster parents. You can do a traditional DBT program and integrate that with another non traditional therapy practice. You can integrate things like Reiki and massage or whatever interests you in terms of somatic healing, those kinds of things. So, an action step is I want you to think about something that feels non-traditional to you, that's innovative, that you've been wanting to bring into your practice, and think about how you would set up that programming under a nonprofit model. So think of three different ways that you could serve an underserved community with these innovative programs. Um, and this could be the start of your signature nonprofit. So let's bring this all home. Today we covered systemic change through services, diverse funding beyond insurance, building a mission driven team, and really developing innovative programs for underserved populations. The nonprofit model really is more than just business, about creating a movement of sustainable, accessible, and impactful mental health care. So, your next step is to choose one pillar to focus on in the next 30 days. Don't try to do it all at once, just take one step forward at a time. And if you're ready to go deeper, then I definitely would love to connect with you. You can join my Facebook group. You can download my free blueprint on how to start a nonprofit. You can also book a strategy call. Together, we're going to build these nonprofit practices that not only heal individuals, but they transform entire communities. And that is truly my passion and why I started this group. So, again, I'll link some of the resources. And if you want to know a little bit more about what I have to offer, then I'm just going to share it with you real quick. My program, Thriving Impact Building Your Nonprofit Group Practice, I have three different options for you. I have a done for you package where I complete everything in terms of the nonprofit setup, your business plan. You get two coaching calls with me. I basically give you a roadmap and establish the business for you. But you get a 5 year business plan with it, and that package is $997. And then I have a self-study program that you can do on your own in your own time. Download all the templates, fill in the blank templates. That program is $897. And then my full coaching program that gives you access to the course. Twice a week coaching with me and all the templates that you'll need, plus learning everything you need to know about running a nonprofit. That's lifetime access to the course is 3,900 and 12 weeks of coaching with me. So if you're interested in any of those, let me know. Otherwise, comment slides if you want the slides and all the links to the resources that I did. And if you have any questions, put them in the comments. I'm happy to answer. You can DM me. I'm always around and I get back to everybody that has a question. With that, happy Friday. Have a great weekend, and I'll see you next week for my next training.